right, so it's the last session of the day. Welcome to the closing session. Our session is going to focus on the 2018 ALICE report. Deann Cook, the Executive Director of the United Ways of Iowa, will be providing a closing session on the 2018 ALICE report, which is the most comprehensive depiction of financial needs in our state to date. Utilizing data from a variety of sources, the report unveils new measures based on present-day income levels and expenses that show how many Iowan workers are struggling financially and why. In her role as Executive Director of the United Ways of Iowa, Deann is responsible for leading Iowa's largest AmeriCorps program, Iowa Reading Corps. She also advocates for policies to move more Iowa households towards financial stability by improving access to education and health care. And so with that, Deann Cook.
Thank you. Oh, wiped out. Thank you. Thanks for joining us today. I know you've had a lot of information so far, and this probably will just serve as an underscore of the conversations that you've already been having today. So, the United Way ALICE report is done by the United Ways in Iowa. There are 25 United Ways that serve Iowans, and the United Ways of Iowa is the statewide association that brings them together around public policy, training and networking, and statewide programs. One of the statewide initiatives we've done is the ALICE report. This is our second iteration of it. It's designed to be updated every 2 years, so we're now going to be talking about the second one, which was generously sponsored by Alliant Energy and the Iowa Credit Union Foundation. So I know many of you are familiar with ALICE, you've heard about it, but just sort of as a reminder, ALICE is not a person. ALICE stands for Asset Limited, Income Constrained, Employed. So it's looking at the segment of the population that is above federal poverty level, but can't meet a basic needs budget in the county in which they live. This report was released on June 26th of this year. You can see that we had a lot of headlines around it. People are paying attention and listening to this, so we're excited about that because United Way's goal with the report is to continue to share it out with various stakeholders so it can be useful to you in your work. And we don't have an ALICE here with us today, but their stories are very compelling. So one of the pieces of media attention that we had when we released the report was a story about a woman named Michelle who kind of told us about her day-to-day life. So we have a clip from that story.
All right, now you can have your drink.
It's the minivan.
So you get in the back.
That makes things move.
You guys have to fasten her seatbelt for her.
For single mom Michelle Sonderleiter.
My car broke down, and then after that, it was just a struggle.
5 kids.
And we're missing one.
And a full-time job. So she's got no time to lose.
Working, just a $12 an hour job, 40 hours a week, you really don't have money that you can put back to get a new vehicle.
But with the help of United Way, she now can get around with this donated car.
And Michelle said, I really didn't realize I was struggling.
United Way says Michelle is one of 450,000 Iowans fighting every day to afford just the basics.
Below the poverty line, there is a lot of public assistance available, but there is a segment above the poverty line where they're still stretching to cover those 5 basics of food, housing, transportation, health, and childcare.
A new study shows that is 37% of everyone in the entire state. The number's up 6% in 2 years. A major factor, stagnant wages, while costs skyrocket.
That everything is a lot more expensive than it was 2 years ago.
Leaving many in this state with a troubling trade-off.
Should I fix the car, or that mean I can't buy groceries?
People think that's really the people that don't want to work, the ones that don't have jobs, that maybe have some other issues, whether it's alcohol, drugs, something else, but it's literally the working class person that just doesn't make ends meet.
So, as noted in the story, the number we were going for were how many Iowa households fall into this group. And what we learned was 12% of Iowa households are below the federal poverty level, and an additional 25% are above that federal poverty level but are struggling to meet their basic needs, which puts our ALICE threshold in Iowa at 37%. In any given day, week, month, year, 37% of our Iowa households are struggling to cover those 5 basics. So we looked at this over time, and this report, if you're familiar with the last report, this report spent a lot more time looking at our data over time from 2010 to 2016, which is the year for most recent data was available. If you watch that gray bar there, you can see how it's increased since 2010. Back in 2010, there were, our below federal poverty level has stayed pretty even at 12%, but that middle group is growing. So it's gone from 18 to 25% over time. That's 6 years of the study. Oh, sorry, I went backwards. The reasons why, and some of them were highlighted in the news story. First of all, the basic cost of living has increased substantially. The budget of the survival that we'll look at in a couple of minutes has gone up by 41% over those years. The unemployment is low in Iowa, but the wages have remained low. Wages are pretty stagnant. So we hear lots and lots about the unemployment rate in Iowa, and it's great, but that doesn't mean everyone is doing well. In fact, the Washington Post did a story a couple of months ago about Story County in particular, which has very, very low unemployment rate, and sort of uncovering, does that really mean everyone's doing well? And the answer is no. Lots of people are working, but they're working for very low wages that don't sustain their families. Public assistance, yes, public assistance is available, but it supports families mainly below the federal poverty level. Most ALICE families make above the eligibility limits for those programs. And just a note about federal poverty level, it was designed back in the early 60s by a researcher named Molly Oshansky, and what she did was take the USDA food budget, triple it, and they started calling that federal poverty level. That was the methodology. That's not even what she was trying to do. She wasn't trying to establish a baseline for federal poverty. What she was trying to do is sort of what the ALICE report does, which is look at the opportunities available for families in various income categories and economic circumstances. But we have latched on to that FPL as our determinant. And what ALICE is really telling us is that's probably not a very accurate measurement. So when we use that to talk about who's poor and who's not, we're missing lots of people in the middle. And I've just explained that point. So who is ALICE in Iowa? You got a couple quick demographics from the news story. And a lot of what the report does is kind of help us change our mindset from you work and you're fine, and you don't work and all the stereotypes we have about that. So about 460,000 Iowa households live below the ALICE threshold. 150,000 of those are below federal poverty level, and the remainder, that remaining 25% of those total Iowa households are in the ALICE population. Another stereotype we have, and I've heard this when we share the report out, it's those single moms. It's those single moms. We want to blame it on one particular demographic. What we know from the report is that's not true. About a third of households in Iowa with children live below the ALICE threshold. Half of those do belong to single female-headed households. A third of those families are married. Married parents, there are two parents, and 15% belong to male-headed households. So you start to uncover that you can't just blame this all on one demographic. And it's also, ALICE lives everywhere in Iowa. The best county we have in Iowa is Plymouth at 26%, and that goes up to over half of Decatur County. So the best county we have in Iowa, still 1/4 of those families are struggling. This looks at who the households are. So again, back to who is ALICE. You can see that the primary ALICE population are single or cohabitating adults who have no kids under the age of 18. Secondly, it's seniors. 33% of senior households are in the ALICE population. So what that tells us is they have enough support to stay above FPL, but not really enough support to survive. And you can see really it's families with children that are doing the best. Another stereotype we have about ALICE population is that it's single people. I've also had people say, well, of course, we were all ALICE when we were young, and that's probably true. Most of us have gone through that. But what you can see, again, if you watch that center gray section, it dips down, but it doesn't go away. Still, in those prime working years of 25 years old to 64 years old, 21% of that group still remains in the ALICE population, and that goes back up to that senior number. So yes, age and hitting the prime working years makes it better, but it doesn't make it go away. And a visual representation of it is to look at a map of Iowa. So the map labeled 2010 is the ALICE thresholds at that time, and now you can look at the 2016 map. And the way to read it is, the lighter the county, the better the conditions. So you can see that that map has significantly darkened over the 6 years. The problem is not going away. So again, it's all types of households, it's in all parts of our state, and it's not getting better. The next part of the report talks a little bit about the budget. How do they come up with these numbers? So the budget methodology, there are only 6 things really in the budget: food, transportation, health, care, childcare, and housing. There's also a smartphone has been added in this year. So housing is the fair market rent, an efficiency apartment for a single person, and a modest 2-bedroom apartment for a family. Childcare is registered in-home care, not center-based care. Food is the USDA Thrifty Plan, and we'll talk a little bit more about that. Transportation is the average expenditure to run a vehicle. Healthcare is out-of-pocket expenses and the ACA penalty, because you will see in the budget, an ALICE family can't even afford the cheapest ACA plan. Technology, it's really impossible to work in today's economy without some piece of technology or a smartphone. So the lowest cost smartphone plan has been added into this budget, which is a change from last time. And then basic federal, state, and income taxes, the taxes that you pay, any deductions for which the family is eligible are factored in. So here's the ALICE budget. I know the numbers are probably small from some of your seats. So it shows us that a single adult needs to make about $20,000 to get over that survival hump, and a family with 2 children who are both in child care needs almost $57,000 to survive. And when you think about those numbers, you think that doesn't, particularly the family number, doesn't sound that low. But when you look at the items one by one and reflect on your own budget, you can see that these are really minimal survival level. And there is a lot of things missing in the budget. There's no eating out, there's no student loan payments, there's no birthday gifts, there's really nothing extra in here at all that, as you reflect on your family budget, you probably have included. It's worth noting that the ALICE report also includes a stability budget. So that is a budget that would would allow a family to support and sustain a secure, viable household. It's more than double the survival budget. And we don't spend a lot of time talking about it because it's a big number, and people would probably think that seems so unrealistic. So here's what changes in the stability budget that makes it higher. Median rent or moderate mortgage, so it improves the housing a bit. Licensed accredited child care versus in-home care. Moving to the USDA moderate plan plus 1 meal out per month. Leasing and operating a vehicle, because most vehicles owned by ALICE families are very unreliable. Employer health insurance and out-of-pocket costs. And a smartphone for each adult. So it's really not living way outside the means, but it significantly takes the cost of living up for that family. And then 10% for savings and contingencies, because as you all know, in a lot of the work that you do, there is no savings for contingencies. There are a lot of other reports that look at similar numbers. They use different methodologies, but you can see a couple things from this chart. First of all, federal poverty level isn't telling us much. And secondly, no matter what methodology you use, many families are coming up short. I wanted to look into the USDA Thrifty Plan a little bit, mainly because last year I heard Secretary Vilsack talk about it so much, and we talk about the Thrifty Plan, but I hadn't spent a lot of time digging into it. So this is the basis for the SNAP program. First of all, it was last revised over 10 years ago. The typical household spends 22% more than the Thrifty Plan. And the USDA itself admits that it's not nutritionally adequate and it's really only for temporary use. The USDA doesn't even expect that a family could exist on the Thrifty plan. And it also makes several assumptions that may be a little bit out of character with how families live. It assumes access to quality, affordable food. So it's assuming that you can get to a grocery store, that you don't live in a food desert, and that you have transportation to do it. And also that your kitchen and cooking facilities are adequate to make every single bite of food you eat at home, homemade. Convenience, there are no prepared foods or meals away from home, which if you think about today's life and a lot of our Alice families balancing multiple jobs, that's a little bit unrealistic. One study shows that families that actually follow the Thrifty food plan spend more than 3 hours per day preparing food at home. It accounts for less than 5% food waste, and there is no allowance for special dietary needs. So it tells you that having that Thrifty food plan in the budget is really very bare bones and difficult to follow. So Alice's jobs, and many times she has more than one. Employers have gotten much better at shifting risk from the employer to the employee, so you can see that in a lot of the workforce trends. We now have more of a contingent workforce. Companies are a lot smarter about when and where they need to deploy workers, which results in unpredictable schedules. So a lot of what we hear is Alice just needs to budget better. But if you don't know how many hours you're going to have from week to week, it's really difficult to budget. The gig economy or the consulting economy. So lots of people are out on their own, doing their own hustle, versus having the stability of an employer, which means no benefits, no time off, no health insurance, no retirement. The employee is taking all the risks. So it's very, very difficult to map out your life and map out your budget when you're living in such an unpredictable work environment. 66% of all jobs pay less than $20 an hour in Iowa. If you reflect back on that budget, that's about half of what that family would need. Here's a visual representation of wages in Iowa. So you can see 66% pay less than $20 an hour, and many of those are in the $10 to $15 category. Some are even below $10 an hour. And that scales down as you go higher in the per hour wage. So people are, again, it helps to understand why people can be working and still struggling. Almost 50% of Iowa households can't cover 3 months of expenses without income. And I think that's when we see, obviously you know this on the front lines if you are, that's when we see our families utilizing our food banks and food pantries. So Alice's benefits. Yes, there are public benefits, but this chart just illustrates how they really don't reach to the Alice population. Those folks who are working and earning are generally above eligibility levels for most of these benefits. So they're not able to access those. One of them that United Way's work on a lot that I'm sure many of you know about is the child care cliff. So child care is the most expensive thing in a family's budget. And yet once you get to 145% of federal poverty level, you have no access to any assistance. This chart shows us the gap across those 5 or 6 basic areas of the budget. You can see that the blue line is the Alice budget. The gold is how much those families living below the Alice threshold earn. And in most cases, it's about half. And then there's a little bit of benefits on top that are accessible to families below the Alice threshold, mainly those below federal poverty level. But you can see that in all of them, gaps remain. Childcare, for example, still has an over 50% gap between what is needed for survival and what's available. So the food gap, to look at one specifically, food is 11% of the Alice survival budget. There is assistance available in the form of SNAP, WIC, school breakfast and lunches, which accounts for about $715 million of spending in Iowa. Additionally, lots of us who are in nonprofits, either food banks, food pantries, whatever that looks like, provide an additional $18 million to assist with that gap. but there still remains 20% short of the most basic needs. So families are struggling with food. And when you go back to that prior, I gotta get rid of all those. When you go back, that's where you see the juggle. There is not enough to cover these basics. So that's when families start juggling. And food is one that is the most flexible. Housing is kind of set. You have to have a vehicle. Childcare is kind of set, but that's another place where people juggle and make different choices. So Alice is really all about juggling and trying to get not enough to cover everything needed. So resources. Again, United Way's don't want to control this information. United Way's want to continue to push it out and make it available to stakeholders who can utilize it to talk about their needs and what they're seeing in their communities. So here's a few ways that you can do that. First of all, you can access the full report at our website. You can download the entire book. Secondly, for every county in Iowa, there are 2 county pages. The numbers that I've been talking about are statewide averages. The Alice report breaks it down to a much more granular level. So if you're just serving a certain region or a certain county, you can see Alice as it applies in that area that you're serving. So it talks about the Alice threshold in a county. It talks about the types of households that are in the Alice population. It gives the budget specific to that county because costs vary across the state. And it talks about the jobs and the average wages in that county. Up in the corner, in that small box that's probably really hard to read, every community in Iowa that has at least 100 households has their own Alice threshold. So one of the reasons United Way's really like this report is that it breaks it down at the community level. So no matter if you're serving the whole state or you're serving a very specific community, you can look to these county pages for some specific information. And finally, to bring the report to life a little bit, we have an Alice online simulator called Making Tough Choices. And if you see that screen at the top is a bank balance. Across the bottom are tick marks for the days of the month. There are 30 tick marks across the bottom. And through the center rotate a lot of choices and situations that Alice might incur. And the goal is to try to get through the month without that bank balance going to zero. And throughout, as you're making choices, it's giving you facts from the report. So it's helping you to break down and understand that report better and why these choices are tough for Alice families. Again, taking those 5 items and really having to juggle and move things around to cover all the needs. So that's a way that we can really bring it to life. So what's next? Again, it's a persistent issue that's not improving. We're finding it has increased since we did our first report. It's not getting better. Second of all, and I usually say this at the beginning, there's no magic slide at the end that says, here's how we fix it. There's not one magic solution. We tend to work in silos, as many of you know from the work that you do, and it really will take those silos talking to each other. It also challenges assumptions about who's poor and kind of changing that mindset of you work and you're fine and you don't work and everything we think about that. There's a whole lot in the middle. All stakeholders join together. So again, that breaking down that silo, there's not one way to solve this. There's not one way to address it. So for example, in Iowa City, they are having some sort of forums together as a county to talk about it, bringing stakeholders from all sorts of government and nonprofit and education and all various stakeholders together to talk about what their numbers are in Johnson County and how they can address it. Structural changes are required. It's not just, oh, we'll work on minimum wage. Minimum wage won't get us all the way there anyway. So the Alice report is really what we hope that we've offered up to the state is a jumping off point for new and better ideas. First of all, to recognize there is an issue. Second of all, to understand the extent of the issue. And finally, to be able to talk about it and work through it as a group of people versus each of us paying attention to it only in our own silo. So with that, I would love to have a little bit of discussion or answer any questions and talk about how we might make this goal a reality. And I think we have a microphone out there somewhere.
Hi. Well, this was always really amazing data and information put together, and you talked about how you can see things at a state level. Is there a way that you can combine some of the counties together if you do work in a regional level in an easy format?
There is. If you go to the United Way Alice Project, you can look at Iowa and you can combine. You can click and join together contiguous counties and see what the report looks like joining those together. Yes, up front.
How does Iowa compare to other states?
So we now have ALICE thresholds for every state, and there are some that are at 50%. So for example, New Mexico, I think New York and Florida are all at a 50% ALICE threshold. So you compare us at 37%. We are generally, with our neighbors, the Dakotas, Wisconsin, Minnesota are all in the mid-30s. I think the best state is 33%. So we're toward the better end, but we're still at nearly 40%. And I will also note, Sarah Rice from DMARC is on our Research Advisory Council that's created for each state, and we've spent a lot of time talking about how she uses the data. And one of the things that they do differently than the report does is the report looks at households. They look at individuals because they've learned that households shift and change every month. That family looks different. And the other thing worth noting is that they do survey their clients, and most make over federal poverty level. So again, just another reinforcement that that's not telling us a whole lot.
I have a question about how would you say our representatives, are they aware of this population of people who are struggling yet employed, have health insurance, but it's super expensive taking a large chunk of the income? Just these problems that maybe aren't so obvious to them. How do we communicate that to them, or do you have any thoughts on that?
We see a range. We see some who get it immediately. We see others who it's more of a challenge to help them understand because they still live in that mindset of unemployment's low, people are working, it's fine. But I would say that we've had a lot of success when we share the report because it is nonpartisan data, that they will listen to it. So we did some advocacy around SNAP this summer, and we had Congressman King come to Story County and gave him a one-pager and walked him through it, and he really grasped onto it and said, I really had no idea of the extent of the issue, and I didn't understand it. So I would call that a win. And I think that continuing to share it and continuing, what Alice really does is it helps us frame it. So again, it's not a person, but it does help us talk about Alice's job, Alice's kids, Alice's expenses, and to some degree puts a face on it, and it seems to be stickier for people, and they can hang on to that. So I would say, yes, they're not aware of the extent of the issue, but generally with an open mind, they can kind of see what we're talking about, and they believe it because of the data. She sees somebody and I see somebody at the same time. Oh, well, she's over to you now, so then we'll give her a workout.
All right, we'll give her a workout. Okay, sounds good. Is the $20 and the $15 because this is more of a rural state? I come from Maryland. I've only been here for 7 weeks, and you cannot live in Maryland on $20 an hour.
Yes.
I mean, that's a very low wage.
That is one of the things the researchers have pointed out about Iowa repeatedly, is that we're a very low wage state. So our expenses to live are increasing, not to the levels of a Maryland, but they are increasing, and our wages just aren't keeping up. The biggest category of workers in Iowa is retail sales, who make about $10 an hour. So that gives you a little guide.
So I'm always an action-oriented person, and I hope a lot of you in the room are, because you're here and you're still present and trying to learn. My question's kind of two-part. So as an individual, what can all of us in the room do to start chipping away or helping lessen that ALICE impact in our state? And then on a macro level, what are some of the big things that we should be advocating for from a policy or system standpoint that can be beneficial to our goal of making a tremendous impact?
Sure. So I think many of you are, as you pointed out, stayed in the room. Thank you for doing that. So you are involved in conversations that affect Alice's life every day. And just flipping that switch in your brain. So we can be really committed to the work that we do, and until you start to see it through this lens and recognize problems through this lens, it's there, but you're not talking about it. So on an individual level, I would say, keep talking about it, keep bringing it up in conversations. Alice is not in very many of the rooms where decisions about her life are made. So if you are, serve as this lens for people and help them understand. On a broader level, so I have pointed out the child care cliff is a big issue that we work on in Iowa, because the ALICE survival budget is about 200% of federal poverty level. So those families that fall off child care assistance at 145% have a long way to go before they can get to survival. So we work on that issue really hard. And I would say, in general, we work on barriers to employment, because moving Alice into more financially secure employment is one of the ways to address this. So we work on access to education, both at the pre-K through 12 level and at the post-high school level. We work on barriers to transportation. We work on barriers to childcare. And another piece that we're doing, if you have access to employers, it's hard for them to hear this information, it's hard for them to see it, but many of them, once they do, get it. And there have been a lot of changes we've seen within companies and policies to help workers address their needs that may be keeping them from being 100% fully present at their work, because they're worrying about all these other issues they're carrying around. So those are some of the things that I know are going on. And I think one more. My clock has gone away, so that must mean time has expired.
Actually, I have a comment. I have been working for the last couple of years in looking at brain development in children pre-birth through the first 5 years. And so I think one of the things we need to do is to advocate. So we need to stay in touch with our legislators and our Congress people about these issues. But it really affects our total GDP when we do not take care of these people. And what one of the earlier folks said today is we have to do preventive stuff, not wait until we've got a bunch of problems we have to try and figure out how to solve, which are very complex. But one of the figures that I have seen from an economist is, if we can work on preventative brain development so that a person can have their optimal brain development, we actually get a payback of 13 to 1. So every dollar we spend on that, we actually receive $13 in benefit back from that. So we just really have to, it has to be done at the legislative level. We can feed people forever, but we've got to, like you say, move them beyond needing assistance to have good paying jobs that they can sustain themselves. So I think what each of us in this room can do can be staying in touch with our legislators and our Congress people, and hopefully change their mindset to raise the minimum wage for one. That would be a good thing.
And I think that in summary is really it. We think about Iowa has low unemployment rate. Iowa feeds the world. We're all friendly and care for our neighbors. So at all levels, individual, business, legislative, community organization, whatever it is, the starting point is exactly as you mentioned, to be aware that this is an issue that exists. It needs to continue to be addressed. So thank you for letting us share the report, and I will turn it back over to Madeline.
I'll keep this short and sweet because I know we need to wrap up, but thank you so much for that, Deann. And many thanks to all of you for coming out here today. I know that giving up a day or even just part of your day is quite the sacrifice. And so it is my hope that you can continue the conversations that we've started here today. Today means really little to nothing if we don't continue these conversations with one another and we continue these conversations with the people we work with and interact with. The goal of eliminating food insecurity isn't going to just come from a single conversation. It's going to come from action items. It's going to come from talking to one another. And so it's really my hope and my goal that today is just a starting point for all of you to continue those conversations. And so with that, the one last thing I'll say is I'll encourage you to take our survey. We're looking forward to the 13th annual Iowa Hunger Summit next year on October 14th. And so that'll be hitting your inboxes here in the next 24 hours. Well, and that's it. Thanks so much for coming out, you guys.